So then what I do is there's this little bone right here at the tip of my patella. And it's a really great sharp little tool that I can get in the tissue. So I found that I'll put that right in the middle of the carpals, and I can get into, not a lot, it's not very acute, but I can get into it just a little bit. So now loose fist, flex wrist. Nope, loose one, there you go. Okay, now I'm down, and sometimes just to help my balance, I'll use the table and pull down into it. Okay, go ahead, big extension. Great job. Okay, and relax. So I would continue to do that a few times. Yeah, good job. Totally different feeling already. Completely different feeling to my palpation. So we've got this that's pretty loose. We've got one right here, a little problem child that's not loose at all. So another thing that I'll do, because her extension is limited if it's like this to there, and I want to get full extension. So when I'm doing personal training, I'll have my clients use a yoga block, and I'll put my knee on the arm with them on a yoga block so we can get full extension. Can't do that here. So loose fist, flex wrist. Okay. Get up to the place I want. Now I can use counterpoint with my other fingers, and then full extension all the way down as far as you can. And as she does that, I'm really pushing away to get that tissue to open up. Okay, one more time, and this time I'm going to actually push down and away from the direction that she's going, so all of this fascia and tissue has to open. Okay, 1, 2, and go. Good job, Missy. Big extension. Big fingers, open that, yep. Good, okay. I would do a little bit more for her because she's still a little bound there, but that'll help a lot. Then, what I'm going to do is, remember in pulling the foot, we pronate, then pull. Remember that? Same thing here. I'm going to take my thenar eminence and put it on her thenar eminence. I think it's a little warm in here, a little sweaty. And I'm going to open this up like this. Okay? So what I'm doing is that, and then on the pinky side, then I'm going to lean back and give slight traction for about 30 seconds to really open this whole junction of the metacarpal radius ulna articulation. Little rocking of the carpals. So that's just grabbing the pinky, grabbing the thumb, and then doing some figure 8 circles. And then one more opening here. And I might do this more depending on who they are and how long they've had it. I've done a whole hour on both arms. But that alone, just that therapy one time, can reduce pain and tension quite a bit. Quite a bit. I do the same thing with my own arm, with my knee, when I'm really bad off. Like I'm getting to that point now, doing a lot, and I'm feeling a little bit of a tennis elbow. So when I start to feel the tennis elbow there, kind of pull-ups and all this other stuff, then I just give myself about 5 minutes on each arm, and it's good for about 2 months, 3 months. How's that feel?
Great.
Different.
Yes.
Let's see this.
I feel like.
So last time I had to really work, I would get there right away. Completely
Oh my
different.
gosh.
Thank you.
Very welcome. You can do the same thing. If you've got some issues up here and more of a radial, always look to brachioradialis. Same thing. So you go extension, full extension, wide fingers, tack, hold, flexion. Full flexion. Full flexion. Go, 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 go. Make that fist, make that fist. Press into the table. And it's easier this way because you can get right in between the ulna. Good job. So I would do the same thing right between the ulna here, because this is where a lot of stuff is bound and caught. So it's a two-sided therapy. It's not just one side. I would do both sides. because I need space in that hole, the radius and ulna, to come apart in order to make the carpal bigger, the tunnel bigger. It's part of the tunnel. That's really what's making the tunnel. So, yeah.